Thank you for watching Carolina Chronicles. I'm Nicole Bruno, your host for today's segment of Helping Seniors. On today's segment, we're going to be talking about some tough topics. It's never easy to realize that mom or dad needs more help than they can get at home. With us today is Laurie Ray, Director of Geriatric Care Management at COPE Eldercare. Laurie is going to help us learn more about what to do when our parents need to move. Thank you for joining us, Laurie. So, many of our family members out there in the viewing audience are struggling with the topic of, is it time to move mom or dad? How do you start that conversation with your loved one?
Often you have to just pick up subtle cues in phone conversations or reading emails and seeing things that are indications that something's different with mom and dad. It might be talking to friends and neighbors, church, and usually they're really subtle. It might be when you go home for the holidays. Often that happens, that people go home for the holidays, see that mom and dad are not doing so well, and that's when sort of a change is in the way. So.
And what resources are available to help individuals make that decision?
To make the decision about whether it's time or not to move?
Yes.
If the family's not able to have a conversation amongst themselves, they may need to have a professional like a geriatric care manager come in and talk, just sort of help them negotiate the topic and pick out what the really important issues are. Parents don't always want to hear from their children that mom and dad, you should do this or you should do that. So having somebody outside the family can be really helpful to have that conversation.
So you mentioned geriatric care manager. For our viewing audience, can you describe what that is?
Geriatric care manager is usually a nurse or a social worker who helps families or seniors with finding resources, coordinating those resources, determining needs, assessing what the needs might be, advocating. It might be that a senior is alone with no family or support, so a geriatric care manager can really be their advocate. Helping to find what financial resources are out there, how to pay for things. It's just a good advocate in their ballpark to be on their side.
Okay. Could you give an example of how a geriatric care manager has helped someone in the community for our viewing audience to try to help them fully understand the scope?
Well, an example might be with one family that I work with where mom and dad lived out of state. Dad became sick very quickly and passed away, and he had been taking care of mom, who was doing relatively well, but she did have some degree of dementia. Once the family got down there, they realized how confused she was and that she wasn't safe to live there. So the daughter had to move mom back here to the Triangle area and get her settled with help in their home, trying to manage her from home. And it soon became apparent that mom couldn't stay at home anymore. So my role was to help determine what mom's needs were and then find the right setting for that. And over the last few years, we've watched mom move from independent living to assisted living and now to a member unit. The daughter works full-time, is still local and still very involved in mom's life, but she's also struggling with just watching mom change as her dementia becomes worse. So I go in and visit with mom twice a week just to check on and make sure that she's okay and report to the daughter.
So it sounds like you become a true support network for that family.
For both the senior and the children. It's, they're all the client. We work with the family as a whole.
So you're almost like a liaison between the two.
Not all families can have conversations, and so it helps to have somebody, a third-party professional, be the one to talk about that.
I think there's a lot of question out there, how do we pay for long-term care? What are some of the financial ways that individuals pay for options available, especially for services like yours or making that move into maybe independent assisted long-term care facilities?
Long-term care is extremely expensive, and it can be paid for in a number of ways depending on the setting. Somebody in my role is private pay, or some long-term care insurance might cover the cost of a care manager. COPE Eldercare is a nonprofit, so we provide services based on the income of the senior, so we are unique in that way. But as far as how to pay for assisted living or home care or nursing home, there are resources such as Medicare, Medicaid, and in North Carolina for assisted living there's a program called Special Assistance, and long-term care insurance if somebody has that. And then there's also aid and attendance, which is a program with the Veterans Association that might be a resource. Medicare doesn't pay for any of this kind of care, except if somebody's in a nursing facility for rehab, Medicare may be able to cover that expense. Otherwise, it's private pay or Medicaid.
So it is a big burden.
It's a significant burden because an average assisted living monthly stay might be $5,000 a month.
And what would your advice be to make a great transition?
Part of it, of course, it depends on if it's a physical or cognitive issue, but especially with somebody who has dementia, if you're moving them from home into a facility of some sort, you want to try to make that setting as familiar as possible. So it might be hanging pictures, it might be having furniture in the same placement, just everything to make the environment feel very much like where they just came from. But a huge part is also for the family to sit down with the facility and talk about, these were mom's interests, or this is mom used to eat breakfast every day at 8 o'clock, or used to like to eat breakfast in her nightgown, so that they're trying to model the same routine that mom is accustomed to, so that she's not as thrown off guard by a change. Somebody who's very sharp and cognitive but still needs to make that move, then they need to be part of that decision-making process. They need to be the ones that sit down and say, I would like this, or I would like that, or I don't like this. So much of helping somebody adjust to a new setting is to really communicate with the facility and the staff from the get-go. There, we have a generation of seniors who come from a different time than we do, and not everybody's comfortable with different ethnicities, or they have trouble with hearing, so they may have trouble with language. So making sure that whoever's caring for them is somebody that they can understand and feel comfortable with, because they have to get used to having a stranger in their private space, and that can be very hard.
It sounds like you are a wonderful person to work with, and to have a person out there in the community under your service sounds like they would have a job well done for them. And I really appreciate you taking the time out today to come here and speak with me and to the viewers of Carolina Chronicles. We hope that this segment has been helpful. For more information, please visit our website at www.carolinachronicles.com. Stay tuned for more stories from our friends and neighbors right here on Carolina Chronicles.